On my right here is Rebecca Manzella. Did I pronounce that correctly? And she is the Chief of Occupational Therapy. And then we have Philip Garcia, and he is a behavior analyst. And he'll explain what a behavior analyst is too. So welcome, and you can come over closer, and I'll turn the mic over to you. Do you want to check it out to make sure you can hear them?
Sure. Like, you think from this distance is okay? Okay. Can everyone hear us? We're a bit of a distance from the mic, but if we need to get closer, we can. Hello, everyone.
Hello.
Are you able to hear me loud and
Yes.
clear?
Yes.
Okay, perfect.
Yes.
All right, we're just taking the mic off the stand here. All right. So welcome everyone. I'm Philip Garcia. I am a board certified behavior analyst. So essentially, I provide behavior intervention and also consultation at Villa Esperanza School. My primary role is to work with the students in decreasing some of the severe and problematic behaviors that they display, and also to teach and increase more maladaptive behaviors, more appropriate behaviors here at Villa Esperanza School. And I have here to my right, Rebecca Mancella. I'll let Rebecca introduce herself.
Hi, I'm Rebecca Manzella. I'm an occupational therapist at Villa Esperanza Services, one of 5 clinicians, and I'm the director of the Occupational Therapy Clinic. I know I've spoken to you guys once before about what occupational therapy is, but in OT, we work on all the underlying skills that our students need to be successful in their academic lives at school. So sometimes those are gross and fine motor skills, that could be self-regulation skills, their ability to sustain their attention on a task for an extended period of time so they could be successful in the classroom. So we're going to talk today a little bit about how OT and behavior merge together and give you a perspective on how to manage behaviors successfully. Okay. So I'm going to go over the agenda of what we're going to be talking about today. So we're going to go over how to understand behaviors. We're going to talk about how behavior is influenced by unmet needs and how that triggers a stress response. We're going to talk about the functions of behavior, why do behaviors happen, and then we're going to talk about what do you do. We're going to focus on positive behavior supports, also crisis management and compassionate care.
Thank you, Rebecca. So our first slide, maybe before I go into our first slide, I just want to remind everyone that our presentation is primarily focused on severe behaviors. Not all problematic behaviors get to the extent of being severe, but for the purposes of this presentation, we will be primarily focusing on severe behaviors and which can lead to crisis situations and emergency situations. All of the interventions and strategies that we will review can be applied both proactively and reactively. Proactively meaning how to respond, how do we prevent the behavior from occurring in the first place? And then reactively, how do we respond to the behavior now that it already has occurred? And so with that, we have here some common severe behaviors that we see not only with our students, but also that some parents may see at home with your children. Aggression, we have self-injurious behaviors that could be in the form of, students injuring any part of their body with severe force. We have property destruction, which can include students, throwing heavy, dangerous objects, or also damaging, walls and structures to property. We also have elopement, which could be a pretty severe behavior and lead to many emergency situations, especially if a individual runs into the street in oncoming traffic, or if a student runs into a dangerous environment. I want us all to remember that all behaviors are not intentional misbehavior, but rather they are a form of communication. And because behaviors sometimes become the primary method of communication for our children and for students, when other forms of communication are limited. Behavior often serves as a substitute for language. And behaviors also occur when there is an underlying unmet need experienced by the individual. And so we'll go into our next slide here. I'm sorry, just one. Yeah, there we go. Awesome. So we all have, ourselves and our children and all individuals. We all have, needs. Some of them basic needs, some more complex needs. We kind of broke down potential unmet needs that may trigger behavior if these needs go unmet. We have basic needs such as hunger, thirst, pain, discomfort, and overall feeling that individuals, get that sense of safety and shelter. We have social needs that may be unmet, such as the desire for attention, interaction, or affection. There are also cognitive needs that may be unmet, such as struggling to understand a task or feeling overwhelmed by instruction. And Rebecca will cover extensively any sensory needs that may be unmet as well. Rebecca, would you like to speak more on sensory needs?
Yeah. We all experience our world through our sensory systems, and we all have sensory needs that we need in order to feel secure in our bodies. A lot of the individuals that we serve at Villa have a diagnosis of autism or sensory processing disorder. And so they might have more nuanced sensory needs because their sensory systems are processing their environments differently than we are. But we all have things that we need to feel calm. We need to not feel cold. We need to have a sense of where our body is in space. We need to, sometimes we want to be wrapped up in a blanket to feel secure. We all have things that make our bodies feel right and calm. And so that's just a huge part of how we experience the world, is that we want our bodies and our senses to feel calm and regulated throughout the day. So I'm going to go a little bit into what happens when these unmet needs reach the threshold of a point where your body doesn't know what to do anymore. The needs are not being met. That triggers our threat detection system. And that's part of our limbic system in our body, specifically the amygdala in our brain. And that plays a role in emotional processing and our body's ability to respond appropriately to threats. And I'm sure you guys have all heard fight or flight. And so I'll go a little bit more into detail about that, but that's a natural response of our body, is to be able to look at the environment and determine what's a threat and what's not. So our brain sometimes can be over responsive or overloaded, and that triggers our stress response system. So a lot of times when we have individuals that are experiencing really big or severe behaviors, their threat response system has rightly been activated, or is being a little bit overreactive and maybe receiving things as stressful when they shouldn't be. So our brains have a job to do. They have to take in the sensory input and they have to say, is this a threat or is this not a threat? And so we have two responses to that. We have a stress response, which is called our sympathetic nervous system. And the job of our sympathetic nervous system is to speed up our heart rate. It's to increase our breathing rate, get all of our organs ready to fight or flight or have some sort of response that's going to protect us. Our stress response is our protective response. Or we have the parasympathetic nervous system, which is our rest and calm functions. And that slows down our heart rate, that slows down our breathing and tells us that we're relaxed and we're safe. So our stress responses to threats are fight, flight, or freeze. So, we go into a fight response when we're stressed. We might all feel that when someone aggravates you or someone cuts you off on the freeway, right? Our body's naturally speeding up our heart rate and we're trying to take a threat and respond to it appropriately. And so sometimes when we see severe behaviors, individuals that have reached their threshold and become stressed will go into fight mode. Sometimes they'll go into flight mode, which is what Philip just talked about with elopement. Get out of there, run away from what is stressing them out or what's causing that overload. And then we also have a third response, which isn't often talked about, and that's freeze. And that's when everything just kind of shuts down and no response is made. So sometimes an individual might not be able to make a choice to help themselves feel better. They're stuck. Their body won't move. They can't speak about what's happening. They're just stuck in the discomfort and in that stress response. So the goal is when we're in crisis mode, we need to move our nervous system from sympathetic to parasympathetic. So our body's in a natural fight, flight, or freeze response. How do we get from our sympathetic nervous system being activated to our parasympathetic nervous system being activated? How do we reduce the heart rate, calm the body down, and get into that calm and relaxed state? So we're going to talk about that throughout our presentation, but keep those things in mind. There are specific things that we can do to reverse the activation of the sympathetic nervous system and bring it into a calm state. Some of those things are sensory input, and then some of those things, Philip, do you want to talk about deep breathing?
Yes, definitely. So some characteristics of when we are in that stress response, when our sympathetic nervous system is kicking in. Some physiological characteristics of our body in that state. Our heart rate increases, but with that increased heart rate, we have more shallow breaths. And so because our breaths are a little more shallow, and because our bodies are in that fight or flight mode, a lot of oxygen and blood is redirected away from our brain and directed to our legs and our arms, and our bodies are getting ready to either fight or flight. And so in order to get our and this is just a biological physiological response that through evolution we have, that's how our bodies have been able to survive. But now in modern times, that fight or flight doesn't really serve us well, especially for some of our children or individuals or students on the spectrum or with behavioral needs. Their bodies sometimes are very constantly in that fight or flight state. And so to get our bodies back from a stress response, meaning our sympathetic nervous system is kicking in, our heart rate is increasing, we have shallow breath, blood flow and oxygen is directed away from our brain, we want to get ourselves back to a more restful and calm physiological state. We want our parasympathetic nervous system to begin activating. And part of that process, it involves increasing oxygen to the brain. That way, as individuals, both our children and ourselves as well, when we have more blood flow and increased oxygen to the brain, we are better able to regulate ourselves, and our cognitive processing is a lot more, capable of, healthy cognitive processing involves increase oxygen to the brain. And so part of, going from the sympathetic nervous system activation to the parasympathetic nervous system activation does involve increase oxygen to our brain, which could involve deep breathing techniques, in addition to, the many other behavior and sensory techniques that we're going to cover today. So we wanted to start our presentation off reviewing some of the potential unmet needs that our children and individuals and students may experience. And now I want to relate that to the 4 functions of behavior. And I apologize for our slide. It looks like it didn't quite, the format didn't quite transfer over. Our apologies for that. But nonetheless, in our discussion today, all behaviors are going to fall under one of these 4 categories. We have access, escape, attention, and sensory as a function of behavior. The first, for access, if a behavior, and the function essentially means why. Why is the behavior happening? We have that context of unmet needs, and the brain, sort of the physiological responses of our body and the brain. But now let's discuss the function, which is the why the behavior is occurring. What was the trigger to this behavior? And I'll review access, which, if the function of the behavior is access, the behavior occurs to obtain a desired object, activity, or specific item, such as toys or food. The second function we have is escape. When the behavior function is escape, the individual engages in the behavior to avoid or escape a task, demand, or situation they find unpleasant or aversive. The third function we have here is for attention. The behavior is performed to gain attention from others, whether it is positive, such as receiving praise or positive social interactions, or sometimes negative, which can involve scolding or reprimands that we give to our children, our students, or other individuals as well. And the last function we have here, I'll let Rebecca speak more about it, but that function would be a sensory function.
So sometimes behavior serves to meet a sensory need. And so it could be they have a need for movement, or they have a need for pressure. And so sometimes we see students that might hit themselves because they're seeking that pressure in their body, and that helps them feel calm. We do sometimes see students that might be causing pain to themselves through self-injury because they have another pain in their body. Maybe they have a stomach ache, maybe there's something going on digestively, or they sprained their ankle. And so has anyone ever pinched themselves when they feel another pain happening? That kind of conflicting pain signal helps us deal with other pain. And we do see behaviors that happen because of that sensory system as well. But yeah, that's.
Thank you, Rebecca. So if we could recognize the function, if we could determine why the behavior is happening, we will better, recognizing the function helps tailor our interventions. So if we know the function, we can provide specific interventions so that our individuals can engage in an alternative behavior that still serves the same function. And so today we will be covering, we broke it down into 3 categories as far as positive behavior supports. And before I go into the 3, I do want to say that, the topic today is, how do we manage severe problem behaviors? And I always, before I talk about interventions, whether they're proactive or reactive, I do want to say that majority of the time, 75% to 80% of a successful behavior management plan is focused on prevention. In addition to prevention, there is a huge focus on teaching new skills and new expectations for our children, our students, and our individuals that we serve. And so not all of our interventions are reactive strategies, although we can use them reactively. The best way to go about, reducing problem behaviors and a solid, behavior intervention plan is focused on prevention and using proactive strategies, meaning working on skills before the behavior occurs so that the behavior is less likely to occur. And so we're going to go into 3 categories. We broke it down into environmental modifications. We also have, for number 2, the teaching of new skills. And number 2 and 3 are very related, and we condense them into, we're going to talk about both of them at the same time, essentially, because you really can't teach a new skill without reinforcement. And so that's our third one, the reinforcement of positive behaviors. And so we will be covering these 3 categories as far as a solid behavior management plan for our individuals. So we'll start off with environmental modifications. And really this is step 1. Sometimes a solid, robust intervention plan may not need to be the main focus. Sometimes some simple environmental modifications could go a long way in preventing or decreasing the frequency of some of these severe problematic behaviors. And all the environmental modifications are preventative strategies. They are also proactive approaches to behavior, meaning we modify the environment so that the behavior does not occur in the first place. And they're very individualized. So whenever we modify the environment, whether at home or in the classroom, it's really tailored to our students or our children's individualized preferences and individualized needs as well. And so we broke down the categories as far as environmental modifications. We have 5 potential categories that the environment consists of and how we can modify, those different aspects of the environment. And so the first we have here are triggers. We want to understand our child's or our students' triggers and make adjustments. And like I said before, we want to always make sure whatever adjustments we make to the environment, they are tailored to individual preferences. So for example, if we know if a certain item or a certain scent or object in the environment sometimes triggers our students or our children, we can simply remove that object from the environment. Or if our students have a preference for lighting, and sometimes we notice maybe if the lighting is set differently, that may trigger behavior. A way we can modify the environment, is to ensure that the lighting is always set to, our child's preference. In addition to understanding our individuals' triggers, we also want to ensure that there is structure and routine in our individuals' environment, meaning we want to create predictable routines and clear schedules and expectations to help individuals know what to expect. And this can really greatly help with reducing anxiety. In addition, we also have visual supports. Visuals help clarify expectations and serve as additional prompts and consistent cues. Some common use of visuals include a visual schedule, visual timers. We also have visual reminders that we may add to our students' environment, as well as choice boards to manage, to address behaviors. For the last two, Rebecca will cover these two environmental modifications.
So sensory diets kind of fall into specific routines as well, but specifically routines that help maintain sensory regulation. So a lot of individuals with sensory processing needs, they're either over responding to specific sensory input or they're under responding to specific sensory input. So for example, if a student or a child does not feel touch as much, that might mean that their body eventually reaches a point where they're activating a stress response because they don't feel their tactile or touch input in their body. And so proactively, if you provide touch input like squeezes or a massager or something once every hour, then their body never reaches that point of stress activation because their body's getting the sensory input that it needs. So those are some things that can be scheduled throughout their day, just like we get hungry if we don't eat throughout the day. Students have a diet of sensory input that they can receive throughout the day so that they are getting the input that their body needs to feel calm and regulated. And then we have the last one, which is safe spaces or calming areas. So this is creating a designated safe or calming space that can give individuals an area where they can retreat to when they feel overwhelmed or overstimulated. So something that they know, this is where I can go so that I can escape the lights. Maybe it's a dimmer space, maybe it's a little tent in their bedroom. Maybe it's a swing chair in their bedroom. They know that this is the spot I can go to that I can feel calm and safe and get myself removed from any potential triggers or aversive stimuli, that they can bring themselves back into a regulated state. This is also like having access to the sensory tools that they need to keep themselves calm. So it could be fidgets, it could be a weighted blanket, knowing where those items are in their space and their personal space so that they're accessible to them. It could also be padding. So, if our students are having severe behaviors, such as headbanging, maybe it's a part of the room that has padding against the walls so that they're not going to injure themselves when they engage in that kind of self-injurious behavior.
Thank you, Rebecca. So that was sort of a brief overview of potential environmental modifications we can make, as a first step to a solid plan in managing severe problematic behaviors. We're going to go a little more extensively into the next two, which are teaching new skills and the usage of reinforcement for positive behaviors. We combined them together. There, you're good. We combined them together just because it made more sense. When we're going to talk about teaching new skills, it's really hard to discuss that without talking about reinforcement and how that plays a role into skill acquisition for learning new skills. So real quick, Jordan, do you mind going back real quick? Yeah, thank you. So these are, when we talk about teaching new skills, we're talking about replacement behaviors. How can our students and children still get their needs met based off of the function? What kind of new skill can we teach that still serves the same function, but it's just a more appropriate, more adaptive way of communicating? And in that, we have proactive and reactive strategies. And again, they are very individualized based off of, what exactly our children or our students, why they're having their behavior. So next slide, Jordan. Thank you. All right, so briefly, I just wanted to remind us all of the 4 functions of behavior. We are going to go into depth for each one. But just to always remember that once we could recognize the function of a behavior, whether it be access, escape, attention, or a sensory need, if we can recognize the function, we are better able to tailor our interventions. Next slide, Jordan. Thank you, thank you. So I'm going to cover very specific interventions we can utilize with our children and our students. If the function is access, again, if the behavior occurs to obtain a desired object, activity, or a specific item, such as toys or food, and various other items or activities that our children or our students want to access. Here are some common strategies, ABA strategies that can be utilized to help manage a severe behavior if the function is access. So the first here we have functional communication training, which comes down to teaching a child or a student a more appropriate way of communicating their needs. For access, we want our students to, specifically request for the specific item that they want. And they can use multimodal communication. It doesn't always have to be verbal communication. Our children and our students, have various forms of communication. So maybe some of our students or our children, it works better for them to utilize an AAC device, such as an iPad, where they have a software for communication. Also, picture exchange cards, PECs. Sometimes our students have, a variety of options, of cards to, hand to their caregiver or their aide to communicate, that they want access to a certain activity or item. And also sign language. Some of our students or children may be capable of communicating through sign language. So multimodal forms of communication can be utilized when it comes to functional communication training. This ties in also to our second intervention here, which is providing differential reinforcement of alternative behaviors. I know it's a long, it sounds very fancy. For short, DRA is what it's commonly referred to, but essentially this means that we reinforce an appropriate behavior. So in this case, for example, we reinforce a student communicating their wants and needs, what they want access to, whether that is on a tablet, an iPad, sign language, or verbally. We want to reinforce that behavior that serves the same function as the problem behavior. But also we are withholding reinforcement for the inappropriate behavior. So for example, if our student or a child, wants an item, a toy, and they start engaging in, aggression or severe SIB, we want to prompt our child or our student to request for that item, opposed to providing the item to our child or student as reaction to their behavior. And so sometimes this can mean, we could do this proactively before a behavior occurs, where we're constantly working on functional communication and prompting our students to request items. Or if the behavior occurs, we quickly present, a tablet, a device, or quickly ask, what would you like? As soon as we get even an attempt to communicate, we immediately reinforce that behavior by providing that item immediately, even if it's just an attempt, so that we can slowly build on, successive approximations to the full behavior of, a full request. And sometimes for a full request for some of our students or children is just the name of the item. Sometimes that's the quickest way and the easiest way for our students to communicate. They don't always necessarily need to say, a full sentence, I want, my toy, please. Sometimes just simply saying toy in that moment, we want to reinforce that immediately. So that's what's meant by differential reinforcement of alternative behavior. We also have another technique here. If the function is access, we can pre-teach and prime request. So we proactively teach and prompt prompt our child or our student to use appropriate requests before the problem behavior occurs. We can use visual and verbal cues to remind them to ask appropriately as well. And the last intervention I have here to help support our children or our students is a token economy. I use token economies for most of the clients I've worked with in the past. It's not always a preferred sort of intervention, but I like token economies because it's a system in which a child earns tokens or points for appropriate behaviors, which can later be exchanged for a desired item or activity. For example, each time a student successfully makes a request, that communication is reinforced by a token paired with, we always want to pair reinforcement with some type of social reinforcement as well, such as good job using your words. So sometimes if our students are able to tolerate, collecting tokens throughout the day, maybe that's because offering the item or having access to the activity or item isn't realistic to, have that all day. And so maybe we have to stretch it out. And a token system really is helpful in that situation where the student knows that they earned that token and there are, a certain amount, 3, 4, 5 tokens to earn before the actual item is provided. So those are just a few interventions that we can use both in home and at school if the function of a severe behavior is access. And so that takes us to the next function we have, which is escape. And I'll go over escape. It's if the individual engages in the behavior to avoid or escape a task, a demand, or a situation that they may find unpleasant or aversive, then the function is escape. And so I have here, this happens a lot in school. Some of our students, right? For any typical child, right? Most students want to play. Doing schoolwork, academic work, isn't really preferred, right? And at home as well, sometimes, right? And at home as well, right? Our children just want to relax all day, maybe watch YouTube. I have 2 sons. My boys just want to watch YouTube all day. Sometimes if I simply say, all right, time to go outside. No, we don't want to go outside. So, sometimes we see, a behavior because our students want to escape, a challenging demand or a task. So sometimes here are some potential interventions we can utilize in those situations. So the first, task modification. We can adjust the task to make it more manageable or less aversive. This can mean sometimes simplifying the task or reducing the length, the duration of the task, or offer choices. Say we want our child or our student to complete a certain chore. Maybe we can find a way to implement, our child's or our students' preferred, character or something. Make it a little silly, making the task a little silly for our children, our students. When we offer choices as well, maybe we can ask, do you want to work on math first or language arts first? Or maybe if it's a chore like getting dressed, do you want to get dressed first, or maybe do you want to have breakfast first? When we provide choices, we offer a sense of control for our children and our students. And sometimes that's all our students or our children need and desire, is a sense of control, right? Especially, our individuals that we work with, that are on the spectrum, sometimes, there isn't a lot of control that they feel. A lot of the times they feel, out of control. And so providing a sense of control really can go a long way. And that we can provide a sense of control through providing choices and options. I have here again, as before with access, I have providing differential reinforcement for alternative behaviors, or DRA. and the way this applies for escape as opposed to access, sometimes teaching our children or our students to simply ask for a break or to ask for help can really help with decreasing these severe behaviors. When our students ask or our children ask for help or for a break, we allow them to appropriately escape. We're teaching them, yes, if you can, communicate appropriately, yes, you can always escape a task, rather than having to resort to a severe behavior as communicating that. And we can utilize various prompts, whether that's a verbal prompt, a visual, or we model, I need a break. And then our student or our children can see that being modeled for them. Or we can say, it looks like you need a break. Different cues, different prompts we could throw in there as well. We want to make it easy and quick when we want to teach our students to request for a break. So sometimes we may utilize a break card. Maybe a break card is constantly with, our child or our student when, if they're feeling overwhelmed, they could simply raise a break card, and then that is the form of communication. And we want to immediately reinforce all attempts to communicate. So even if it's not a full sentence, even if it's not a full word, if we know that their intention is that they are trying to communicate rather than engaging in a problematic, severe behavior, we want to reinforce that by providing immediate escape from whatever task we are asking our child or our student to complete. I really like behavior momentum, which is our second to last here. I utilize this a lot. I've utilized it in the past, both in home and at schools. And essentially behavior momentum means, we want to build our students' momentum so that they feel successful. We want to set them up for success. So sometimes this means, if we have a challenging task that we know they're not going to want to complete or that may trigger a behavior, we start with something a little more simple, something preferred, maybe something as simple as, can you throw this away for me? Or can you hand me, a specific item right before you work your way up to a little more challenging tasks. That way, the momentum is already started. Our children and our students already get a little taste of success, and we build upon that rather than going straight into the difficult activity. And we also have teaching coping skills. We want to teach our children or our students relaxation or self-regulation strategies to cope with challenging or frustrating tasks. So for coping strategies and Rebecca will cover more on this, touch more upon this. But when it comes to coping, skills and coping strategies that we want to teach our students, I like for caregivers, parents, and teachers to always consider, and think about what are our own coping strategies, when we're feeling like we don't want to do something or when we really want something but we can't have it. For myself, I really utilize deep breathing a lot of the times. Sometimes we just need to go on a walk, clear our minds a little bit. Coping strategies can get very creative. We all have different creative coping strategies, ways of coping with, negative emotions or, a sense of, frustration, maybe playing loud music. We all have, think of our own and then think of, how might, my child or my student have a similar sort of coping strategy they can utilize. So now that we've gone over access and escape, our last one here that I'll cover before Rebecca goes into hers as well is attention. Sometimes severe behaviors are caused by our students wanting attention. And attention is when the behavior is performed to gain attention from others, whether it be positive attention or negative attention. Both are attention. And so some three strategies that I have for us here is functional communication training. Specifically, we want to teach our children and our students a more appropriate way of requesting for attention. That may mean, requesting play, requesting a hug, requesting for interaction. We want to provide immediate reinforcement in the form of attention when our children or our students make an attempt or do make the full, successful request of appropriately requesting for attention. And attention can mean many things for different students and children. Sometimes just simply having a one-on-one conversation, some one-on-one time. Sometimes a nice, big warm hug is enough. Whatever it is that you think, whatever form of attention that you think your child or your student may want in that moment, you want to immediately provide it when they appropriately request for that. I have here also provide non-contingent reinforcement. In short, NCR is how it's referenced sometimes in ABA. And this is about providing regular scheduled attention without requiring the individual to engage in any specific behavior. And so sometimes this looks like, every 10 minutes, you just go up to your child or you go up to your student and provide, attention, whether that be a conversation, letting them know they're doing a good job, for having a calm body or a good job, for whatever it is that they're doing. They don't need to be doing something specific, but you just provide it regardless. It's just built in. And if you can provide consistent scheduled attention, it will just decrease the motivation for our children and our students to engage in problem behaviors that may otherwise, they may want to seek negative attention. And the last one I have here is differential reinforcement of other behavior. And the way this is different from a DRA or an NCR is that for this type of reinforcement, we provide attention when the individual is not engaging in the severe behavior. So any behavior, that's why we have other here. It could be any other behavior other than severe behavior. You provide attention. So similar to NCR, except this one's more specific to other, where NCR is just, it's on a schedule. Whereas DRO is more like, say, your child or your student is watching TV and, they're not engaging in a severe behavior, just going up to them and providing attention and saying, you're so proud of them, for having a calm body, or, just reinforcing whatever activity it is other than severe behavior. And this helps reduce the frequency of problematic behavior. And so I'm going to hand the microphone to Rebecca. She's going to cover the last function here. Yeah. Oh, yeah. Yeah.
After severe behavior that includes hitting and the child has calmed down, how does the parent then react to the child? Does the parent give a desired item or an award?
Right. So I guess the simple way to answer this question, well, there is no simple way to answer this question, really. It really just depends on the specific circumstance. If the behavior is so severe, where the student may require medical attention, I always say, let's just give the item. There's no need to, withhold an item that's going to trigger, a severe, injury. However, though, if this behavior is every day and, maybe you're a parent or a teacher who's like, what, I really want my child or my student to understand that, just because they're engaging in this, severe behavior, they can't always get their item, that they want, or escape, the situation. And so that's understandable as well. And so if that's the case, I try to instruct parents and teachers, provide that alternative form of communication, present it to your child or your student immediately. And if it means that you have to, hand over hand physically prompt your child or, that your student to make that request, over time, and it may take some time and it may take several behaviors, but over time, your student or your child will make the connection of, I request, I get what I want immediately. And so sometimes, our students will not independently make that request. Sometimes we have to prompt it, full physical prompting, and eventually over time fade it out to partial physical, or maybe we just simply present the item. The communication form, whether it's a tablet, whether it's you know, a picture exchange card, we just hand it to our child or our student right away, just so, you know, we help support them learning that skill of requesting. I believe. Okay, awesome, awesome. Thank you, thank you. All right, Rebecca.
So the last function of behavior is sensory. And we talked a little bit about sensory diets, and that is a preventative strategy. So that could be, for example, 10 minutes of heavy work or movement every hour in a preventative way. But also we want to think about as needed sensory breaks. So this is a reactive strategy. Maybe we see a child or a student that's like getting up and like running across this classroom. Like, what is that behavior, or what is that telling us about what their body needs in that moment? It looks like they need to move. What can we provide or redirect them to that's a safer way of getting that sensory input? So redirect to appropriate sensory breaks. Maybe there's a trampoline in the room that they're in that we can be, okay, your body needs to move. How about we jump instead, so that we're not knocking over things or people if we're sprinting through the classroom or in the bedroom or in the house. So also, like we said earlier, creating a sensory friendly environment. So minimizing noise or visual distractions. Is there a lot of clutter in the room? Is that overwhelming? Is there noise outside, like construction? That's something that our school is undergoing right now. So a lot of the students, the outside noises can be overwhelming for them. So what can we do? Like use headphones or have access to headphones for noise canceling, or maybe putting on a white noise machine to cancel out the other sounds that might be dysregulating. And we also want to teach self-regulation skills. So how do we support self-advocacy? How do we teach more appropriate ways to meet sensory needs and practice those throughout the day? When I need to jump, what do I need to do? I go to the trampoline. When I need pressure, what do I say? Can I have squeezes? Can I have hand squeezes? And encourage those communication requests. So we want to also help develop self-awareness of body states too. Like, I see that your body needs to move. I see that you need pressure. When a student reaches over and squeezes our arm, oh, I see that you need pressure. What can we do instead? And redirect to something more appropriate. So like verbal reflection is really important. And I think kind of like with that question as well is, what do you say afterwards? I see that you felt frustrated. That was so unexpected, or that was so frustrating, or that light was too bright and that was too much, or that was too loud. Reflect back what you see happening, especially for individuals that don't have the communication to be able to say that was hard. Say that was hard, reflect it back to them, and then reflect back what you see has happened to kind of help process what just happened, and then help them make a plan for next time. Next time, let's do this. Or next time, oh, do you need a break? Let's ask for a break. So like Philip was saying, practice the appropriate request. Yeah. Yes, we're actually going to go into the specific sensory systems. Yes, but yes, I will for sure, and I have visuals for that as well. So yes. So we talked a bit about moving from our sympathetic to our parasympathetic nervous system, right? We are wired to calm down with specific sensations. So if you think about like, what do you do when an infant is dysregulated and crying? We swaddle them for compression. We rock them rhythmically and slowly. Those are things that our nervous system, for everyone, will never lose those things. We will always be calmed by those sensations. People that love to dance, that's their love for movement. It's calming and regulating. People that love to bike, that's calming for them. That's how they relieve stress. Those things are wired into us. So we want to think about what sensory things is going to calm us down. So for vestibular system, that's our sense of movement that's located in our ears. So that processes how our head moves in space. So movements that are calming are gentle rhythmic movement, linear movement, and then rocking or swinging. So spinning is not calming. I don't recommend spinning if someone is overwhelmed. So we want to think of smooth movement. So I'll go into each of these more specifically with examples on the pages that follow. But the next thing is proprioceptive. Our proprioceptive sensory system is how we sense the push and pull of our joints. So those receptors are located in every single joint in our body. And so compression and push and pull of those joints is calming. So that's part of why swaddling is calming, because it's compressing the joints, and that tells our body to calm down. We also have tactile input, which is touch. We have two different tactile receptors. We have light touch and deep touch. Light touch is not calming. It's like if someone was like gently touching you, that's like not calming at all. But deep touch, firm touch is going to tell your sensory system and your body to calm down. And then reduction of visual and sound is going to be calming, but also predictable visuals and predictable sound is calming. So like a light toy that spins, that's going to be calming. Or white noise, like a fan, is going to be calming because it's predictable noise. Or maybe a preferred song, it would be calming. Yes. Yeah. So the next page is how we encourage self-advocacy and making choices. So we have like visual charts to express emotions, but we also have charts to help express how our body is feeling. Are we uncomfortable? Are we overwhelmed? Are we needing to use the bathroom? Are we thirsty? Are we hungry? Sometimes if you have a sensory processing need, you're not feeling your internal body states very well. And so that's something we have to teach. What does it feel like to feel hungry? Where do we feel that in our body? What does it feel like to be thirsty? Where do we feel that in our body? And that's something with visuals we could use to help teach that new skill. So interoception is another sensory system, and that's our body's ability to feel and understand our internal organs. And the next one is vestibular sensory tools. So these are some examples of what movement sensory tools might look like. Using a trampoline, using a swing, running or jogging, riding a tricycle, bouncing on a yoga ball, doing stretches. I think maybe we all need a little movement break. This has been a long presentation. If you guys want to stretch, you can. Crashing activities too. And then dancing. So redirecting during when someone is upset to an activity that is preferred for them to meet that need would help calm their body. The next one is proprioceptive sensory tool. So this is, again, our body's ability to push and pull on our joints, right? It's how we feel our body moving in space. Some things that we could do to activate the proprioceptive system to calm down is joint compression. So this is like pushing and pulling of the joints. So you could just compress in onto your wrist or push down into your legs, and that would be activating your proprioceptive system. You can also like curl up in a beanbag that kind of compresses you in that way, and that would be calming. Using something for your hands to compress your finger joints, such as a stress ball or putty, that's also calming. There's things called body socks. I don't know if you guys have heard of them, but you get into them and you kind of like, it's like stretchy fabric and you push against it. You could also use weighted items, because that would push down on like weights in a backpack would push down on your shoulder joints, or using weighted exercise balls is going to compress the joints when you lift them. Heavy work would be lifting or pushing or pulling. So like you could have like a cart full of heavy things and that could be pushed. So all of these strategies can be proactive, but they also can be reactive as well. Like, oh, you're overwhelmed. Let's go deliver this backpack from the kitchen to the living room. Let's pick this up. Let's move it. And that would be calming. Chewies are also very good because that compresses the proprioceptive, your joints in your jaw, which is also for proprioceptive input. Yeah. A chewy is like, it's rubber, but it's food safe. You can chew on it and you won't have any chemicals leaching out. Yes, but for adults too, for kids, for adults, for anyone. Yeah. Yeah. Uh-huh. Yeah, so like they have a bunch of different shapes. They even have necklaces that look cool. So, your child or your student can be wearing it on their neck, and then when they need it, it's accessible. Uh, yeah. Yeah. Yeah, they don't last very long when it's a heavy chair, but it works, right? Because she's gravitates to it. Yeah. You can buy silicone tubing that's for like food safe things, like and that's cheaper, and you just cut that up. But it's also it's a cheaper alternative to Chewies, which can be pricey. Yeah, and you can get a whole tube of it.
There's different sizes and there's different sizes and different sort of objects, different shapes. I worked with a client in his home, and he had this really cool shark tooth Chewy. And it just looked like a really cool, beach vibes, necklace that he was always wearing, but he utilized it very often. They're very useful.
Does anyone stress eat? Yeah, that's very common. People or crunchy snacks, that's also another way. We do that for a reason. It's because it's calming for the nervous system. Yeah. The next page is deep touch tactile input. So some things that you could use is a weighted blanket that activates both deep touch and their proprioceptive system. So it's kind of a combination. Using different fidgets to pull ones that are detachable, pop, squeeze. You could roll them on you too for that kind of input. You could use a massager for vibration. That's calming. Massage and lotion. Massage is a very wonderful one. Motion also has scents that can be calming too. You can do hand squeezes, squeezing the hands of your child to calm them down. Laying under a beanbag for that pressure, for that weight, is a one that's common. That's very calming. Or I don't know if you guys know what a peanut ball is, but it's like shaped like a peanut, but it's kind of like a yoga ball. And you could use that to roll someone if they lay on the floor. You can roll it on their arms or roll it on their torso or on their legs. And that deep touch input is very calming, especially in a crisis situation. Also, just a hug. I mean, who doesn't? We all love hugs for a reason. Hugs are given because they are calming for our nervous system, and that's why they feel good. And the last one is auditory and visual sensory tools. So this could be removing visual input, such as with a hat or sunglasses, removing sound for noise canceling headphones, or it could be also dimming the lights in the room or having a space that's darker, or it could be providing input that's calming, such as using a white noise machine, like I mentioned, or a rhythmic sound. There's a very popular deep breathing video on YouTube that just you hear the sound of the water coming up and down, and it encourages the kid to breathe deeply while watching this fish go up and down. So it's very rhythmic. So the key to like calming sensations is rhythm, slow, and predictable. Because if it's unpredictable, that's not going to calm you down. The light up toy here too is a very predictable spin and also has a good white noise component to it as well, which can be very calming. Any questions on that before I pass it back to Philip?
Thank you, Rebecca. So we essentially reviewed these three: environmental modifications, the teaching of new skills, and reinforcement. However, I do want to touch upon, before we finish, I want to touch upon some additional crisis management techniques. So if you could go to the next slide. What's that? Oh, yeah. So I really want to emphasize these last two here, especially when, severe behavior, reaches the point of a crisis situation. Something that's really important is for whoever is, responding in that moment, whether it's, you as a parent, staff at a school, or any caretaker, it's really important to always have a good self-control plan. not for the individual we're serving, but for ourselves. It's really, easy in the moment when we're in that fight or flight mode. It's really easy to forget to simply breathe. It's really easy to forget, where you are sometimes. And so I think having a good, simple self-control plan that includes deep breathing techniques and positive self-talk, such as reminding yourself, you can do this, saying to yourself, I can do this, I can do this. In that moment, these things aren't going to come naturally to us. So we have to actively practice and actively remind ourselves that we have to take a deep breath and remind ourselves that we can do this. And the more you do that, the more you practice a good, simple self-control plan, the easier it is the quicker and easier it is to be accessed in those times of crisis. And when we get, if a deep breathing is essential to a good self-control plan, we want to get that oxygen back to our brain so that we're better able to make, cognitive decisions in these, crucial moments. Sometimes, if we forget to breathe, we really get caught up in sort of just reacting. But if we could take that deep breath and remind ourselves that we can do this, and that we can get through it, we'll be able to make better decisions in that moment. And also a good self-control plan, we're modeling it for our child and for our students. If they see us having a good sense of self-control, we're breathing heavily, as humans, we naturally, copy, those around us. And so it makes it a lot easier for our students or our children when they're feeling that distress, when they're in that crisis moment. If they see us, calm, we are modeling for how they, can behave as well. And so in addition to that, I want to talk about briefly safety. Whenever a crisis occurs, we want to ensure that the environment is safe by removing any dangerous objects or obstacles that might be in the way. Sometimes we may want to or need to incorporate padded shields or mats in the environment. Sometimes we may have to move away when appropriate so that we are out of range of getting hit, but again, only when appropriate. And definitely, I emphasize this a lot at school and in homes. Call for help in those moments, and have a good a plan, a good emergency plan for who to call in an emergency. That way, in the moment, you're not thinking about these things. They're just, you kind of already prepped for them, and you're ready. So before we end our presentation, I just want to briefly also touch upon the importance and the emphasis on a compassionate care approach. This is something, kind of emerging in the field of, all behavioral, all mental health fields, is having this compassionate care approach, which a lot of what we talked about is a compassionate care approach to dealing with severe behavior. But just briefly, to go over some of these, it's important to always have empathy and rapport with our children and our students. We want to ensure that they feel understood and respected. We also want to show them that we are patient. And whenever I talk about patience, whether it's training staff at school or parent training, something that I wasn't aware of until I really got heavy in the field of behavior, is that the word patience, there's a Latin root word in patience, and it's the first four letters, PATI, which is a Latin root word which translates to suffering. And so how that relates to managing behaviors is that sometimes in those brief moments we suffer in that moment, but to know that there is a way out of it, and with patience, with continuing to show empathy and to practice various interventions, that that suffering isn't forever, and that we can persevere. And it takes time, that things take time, but sometimes we have to suffer in those moments, but in time, things will get better. And so I always found that interesting, the word patience. We also want to make sure that our interventions are non-punitive, meaning that we want to avoid punishment at all costs. Something that Rebecca also touched upon was emotional regulation and support. Often severe behaviors stem from an inability to regulate emotions. We need to teach coping skills. We can use various visual supports to communicate, various emotions and body states. And again, emphasis on co-regulation. When our children, our students see us and how we regulate our bodies, we are modeling for how they can also regulate their bodies. Something that's really emerging in all fields of mental health is a huge focus on trauma-informed care. Sometimes severe behaviors, may sometimes be related to past trauma or adverse experiences. Sometimes simple, trauma doesn't always have to be, very extreme. Sometimes just the trauma of feeling unsuccessful for many years, that is traumatic for many individuals. And so we always want to, approach behavior with that trauma-informed, approach, and having this compassionate care approach, because we want to avoid re-traumatizing our children and our students. We want to use interventions that promote safety, choice, and empowerment. And the last slide about compassionate care, we always want to make sure there's choice and autonomy, and that we provide gentle redirection and de-escalation techniques, and we support cognitive and language processing. And the next slide is our last slide, and it's something that Rebecca and I really want to emphasize. I'll let Rebecca take it from here.
So we want to make sure that, our parents know that you need to set aside time for yourself for self-care, because it is traumatizing also for you to be experiencing the severe behaviors of your child. And if you don't practice your own self-care, it could lead to burnout. And we know how challenging that is. There are parent support groups out there. Connecting with others is a really good way to help to cope and to support each other and like exchange strategies. But also please utilize your care team, your school team, speech, OT, behavior, teacher aid for support and problem solving. We're all there for you. Also, a reminder that regional center is there, and that you can reach out to the case manager for in-home and out-of-home respite care, being able to provide yourself with the time that you need for self-care so that you don't burn out. And also regional center can help support with in-home behavior support as well. As parents, you can have the perfect plan. You can know your child and what they need, and it's going to work 90% of the time, but there's going to be a 10% of the time that you did everything right and it's still not going to work. And it's not your fault. We know the students as well at school, and we could have something that works, for 9 out of 10 weeks, and then on the 10th week or the 10th time, it just doesn't work. And we did everything that we could to prevent a behavior, but it's just going to happen. There's always going to be that one thing, an internal factor or something that was slightly different, that's going to, change what we thought would happen when we used all of these behavior strategies. But just know that you're doing a good job, that you're doing your best. What you do as parents is phenomenal, and just please take care of yourself.